And after that, we'll close it with any final comments. You welcome to join in. Anything you wanted? Okay. So from that standpoint, why don't we keep everybody still here? Your department can go, but why don't we keep everybody here? Let's hear from the public that wants to speak, and then after that, we'll close it with any final comments or anything that the committee may have. So we have 3 cards that would like to speak. Ms. Brandy Melissa, Dr. Vicky Tolliver August, and Leah Noel. So now would be the time for you to come and address the committee, and we want to thank you for your patience of being here, but now would be the time to join us. Ms. Melissa, nice to see you.
Same to you. I'm Brandy, for y'all that don't know me. Other than Representative Mizell, Senator Mizell, I'm sorry. Representative Hughes, and I know Senator McMath in the previous years have discussed why we've been sitting here for 3 hours. The problems that have been in the media this year are nothing new. A couple of years ago, when the people were in this committee, they said changes were going to happen. We have a 2-year-old dead from his 3rd fentanyl overdose, and more foster kids are being molested by their foster parents, and that's also not a first-time occurrence. In the early 90s, not too long after what you mentioned, Senator Luna, I was removed from school on a Friday afternoon for an allergic reaction to a bug bite. Foster kids are supposed to have their own rooms, or own beds. I slept in the living room. The year after, I turned my oldest brother in for molesting me in a house with grown adult men. Nobody said anything. When I filled out my card to talk, people got nervous. I love this current secretary. Even when in 2016, she got in front of a committee and said if the budget was cut, certain calls would get ignored. I wasn't too fond of that. We've been at odds a few times over different stuff because y'all are looking at a non-viable pregnancy because of the domestic violence and late-term pregnancy termination. I have a pretty much non-existent brain and skull right now, and I'm about to be 39 Monday. I just had a wisdom tooth extraction 2 weeks ago. Because of my medical condition, I had to deal with the post-op without pain medication. And I'm sorry, but I don't have the medical record I do with the experience I have. And I can't sit here and be quiet about the stuff that's going on, because it literally irks me to my core. The conditions that these kids are being forced to stay in when they come out of trauma. Imagine somebody being sexually abused, going into a foster home where it continues to happen by their foster parent that was supposed to be guided by the state. You know, they got certified and everything else. They passed all of them tests. My first experience with OCS, DCFS, whatever it was back then, you know, showing my age, was being in an emergency room when all that stuff happened when my brother was molesting me. A sheriff's deputy told my mother if she did not find my brother somewhere else to go, I was going in foster care. A year later, I was for non-abuse. It fractured my entire family. My mom died with her 2 oldest children hating her guts. And I'm sorry, but it needs to stop. In these discussions that y'all been having for 3 hours, I hear during the session in appropriations and finance. This is health and welfare. We're here to talk about dead children, kids being killed from fentanyl overdoses, 2 years old. No hospital gives Narcan to a 2-year-old on a daily basis. Those calls were substantiated because that's not normal. We're talking about kids being sexually violated. To this day, I can't handle certain situations because of what I went through as a child. And that happened from my brother being violated by a Bible college student who is currently writing in Rayburn. That y'all probably saw on Channel 2 in April. It's a cycle that's going to continue till change happens from the top to the bottom. And don't just focus on the secretary of the department. Y'all need to focus on the parish where the problems happen. Because there's somebody sitting in this room that nobody's talking about that needs to be looked into, and I'm leaving it at that. Y'all have a good day.
Thank you for your testimony.